Assalamu alaikum. I am Nuha muzahim. I am third medical student. Our seminar is about hemophilia. Presented by me, Nuha muzahim, Zainab, Mohammed, and Ghofran Salah. Supervised by Dr. Zainab, Ahmed. I will talk about hemophilia. What is hemophilia? History, types, and the causes. So, what is hemophilia? Hemophilia is an inherited X-linked recessive and lifelong blood disorder where an essential blood clotting factor is either partly or completely missing. The blood doesn't clot and cause extensive bleeding even with small injuries. It is caused when blood doesn't have enough clotting factor, where the clotting factor is a protein in the blood that controls bleeding. History of hemophilia. Hemophilia is often called the disease of kings, but it was carried by many members of Europe's royal families. Queen First Victoria of England was a carrier of hemophilia. Originally termed hemophilia, love of hemorrhage, but over time contracted to hemophilia. Types. Hemophilia type A. It is the most common type of hemophilia, and it is the severe one, also called factor A deficiency or called classic hemophilia. Hemophilia A is an X-linked bleeding disorder that occurs in 1 to 5,000 live male pairs worldwide. It is classified as mild, moderate, and severe, depending on the level of clotting factor in the blood. Hemophilia B. Hemophilia type B. It is the second most common type of hemophilia, and it is the moderate one. It was originally named Christmas disease, according to Stephen Christmas, who was first patient affected. It is an X-linked recessive disorder with an incidence of 1 to 25,000 live male pairs. Hemophilia type B results from congenital deficiency or absence of factor IX. Hemophilia A and B, both types hemophilia share the same symptoms and inheritance pattern. Only blood tests can differentiate between the two. Important to know which factor is defective so that the correct treatment can be given. Except in very rare cases, both hemophilia A and B affected only male. In this picture, we can see the locations of hemophilia A and B on X chromosome. The other type is hemophilia type C. Hemophilia C is factor XI deficiency or called Rosenthal syndrome, an autosomal recessive disorder. It is a very rare coagulation disorder, occur with an estimated prevalence of 1 case per 100,000 population of United States. The tendency to bleed is difficult to predict since it varies over time in the same individual and between individuals with a similar blood level of factor XI. As we here in this picture, hemophilia A is the result from the deficiency in factor VIII, and it is the most common type. Hemophilia B results from the deficiency in the factor IX. Hemophilia C results from the deficiency in factor XI, and it is the less common type of the hemophilia. What causes of the hemophilia? As we know, hemophilia is a bleeding disorder usually caused by defect or mutation in the genes that code for the blood clotting factor. The cause is classified into A. Inherited mutation in almost 70% of causes of hemophilia. If the mutation occur in factor VIII gene, result deficiency of the factor VIII and eventually result hemophilia type A. And if the mutation occur in factor IX gene, result deficiency of factor IX and eventually result hemophilia type B. Genes encoding for factors VIII and factor IX are both situated on the X chromosome. As a result, male affected more than female. In male, hemophilia are unaffected, but in female, hemophilia unaffected or carrier. In the cases of hemophilia carrier, female may have low levels of clotting factor and show symptoms of hemophilia such as bleeding. Causes of hemophilia C: mutation in factor 11 gene which is situated on chromosome 4 in an autosomal recessive manner. This type affected male and female equally. B. Spontaneous mutation. Approximately 30% of hemophilia causes are due to spontaneous mutation within the gene. In these causes, the parents are normal and the child develops hemophilia as a result of a new mutation of factor 11 and 9. As a result of a new mutation in factor 8 and 9 of gene occur for first time in the family. And now I let my colleague Zainab to continue.
Hi, I am Zainab Mohammed. I will talk about sign and symptom of hemophilia.
The most common symptom of hemophilia is bleeding, particularly into the joint and muscle. The severity of the symptom depending on how the level of clotting factor in blood. Bleeding can occur on body surface, external or internal. The sign of external bleeding may include bleeding in the mouth, noise bleeding, heavy bleeding from a minor cut, bleeding from a cut that resumes after stopping for a short time. Sign of internal bleeding, blood in urine, blood in stool, large bruises. Bleeding in the joint. The most complication of hemophilia is joint disease. People with hemophilia can bleed into the joint space after any injury or without. The pressure of blood filling the joint cavity causes significant pain and can lead to chronic swelling. Joint damage can occur after repeated bleeding into the same joint or after one serious joint bleed. The joint typically affected include the elbow, ankle, and knee. Bleeding in the brain. Internal bleeding in the brain is a very serious complication of hemophilia. It can happen after simple bump on the head or more serious injury. The sign and symptom of bleeding in the brain include long-lasting, painful headache, seizure, convulsion, double vision, repeated vomiting, sudden weakness. Clotting factor level affected severity. Hemophilia can be mild, moderate, or severe, depending on how much of the clotting factor in the person's blood. The normal range of factor 8 and factor 9 is between 50 to 150%. Degree of severity. Normal range 50 to 150% of clotting factor. Normal blood coagulation. Mild hemophilia 5 to 50% of clotting factor, a bleeding problem usually associated with extraction, surgery, severe accident, often not diagnosed until later in life. Moderate hemophilia 2 to 5% of clotting factor, bleeding usually associated with injury, knock, deep cut, can present like severe hemophilia. Severe hemophilia less than 1% of clotting factor. Bleeding in the frequent and often spontaneous into the joint, muscle, and any site, including brain. Usually diagnosed in first year of life. Complication of hemophilia. Number 1, chronic joint deformities from recurrent bleeding. Number 2, antibodies to transfused factor 8 inhibitor develop only in 20 to 30% of severe patients, not in mild, moderate. Number 3, it's over 60% of persons with hemophilia treated with plasma concentrators in the early 1980 became HIV positive. Thank you, and my colleague will continue.
Assalamu alaikum. I am Ghofran Salah and I will talk about how we can diagnose hemophilic patients. Diagnoses include: first, prenatal testing. If a pregnant woman has a history of hemophilia, a hemophilia gene test can be done during pregnancy. A sample of a placenta is removed from the uterus and tested. This test is known as CVS, chorionic villus sampling test. Second, screening test and clotting factor test. Screening tests are blood tests that show if the blood is clotting properly. They are: first, complete blood count (CBC). The CBC is normal in people with hemophilia, but when the patient has unusual severe bleeding or bleeds for a long time, the hemoglobin and RBC will be low. Second, activated partial thromboplastin time APTT test. Third, prothrombin time PT test. Fourth, fibrinogen test. Last three measure how long it takes for blood to clot. Clotting factor tests are also called factor assays are required to diagnose bleeding disorder. Management strategies. First, prevention of bleeding episodes. Control bleeding episodes and prevent joint degeneration. Also include avoid contact sport and avoid intramuscular injection. Management strategies continue. Second, replacement therapy. Hemophilia can be treated by replacing missing blood clotting factor. This picture shows a blood vessel injured of hemophilic patient without replacement therapy. Lack of clotting factor 8 allows bleeding to continue, but with replacement therapy, the additional factor 8 from replacement therapy helps stop and prevent bleeding. Third, gene therapy. Researchers are trying to develop a way to correct the defective gene that causes hemophilia. And fourth, desmopressin DDAVP for hemophilia A. This medication is a synthetic hormone which encourages the body to produce more of its own factor 8. Fifth, RICE. RICE, it is a collection of the first letters of these four words: rest, ice, compression, elevation. RICE is a treatment many healthcare professionals recommended for joint bleeds. Inhibitors. 30% of people with hemophilia, more commonly A, develop an antibody to the clotting factor they are receiving for treatment. These antibodies are known as inhibitors. This picture shows factor 8 replacement therapy given for hemophilic patient, but the body of this patient form antibodies. Inhibitors are antibodies that prevent factor 8 replacement therapy from controlling bleeding in the people with hemophilia A. These patients are treated with high doses of factor 8 for bleeds or surgery. This overrides defect in factor 8 or factor 9 deficiency. Long-term management involves attempting to eradicate inhibitors by administering high-dose factor 8 or factor 9 in a process called immune tolerance. Acquired factor 8 inhibitors. Acquired hemophilia is an autoimmune disease where the immune system attacks blood clotting factor 8 and inhibits its function, leading to excessive bleeding. Around half of acquired hemophilia cases are considered idiopathic acquired hemophilia, meaning there is no known cause. It often be attributed to associated autoimmune disease like rheumatoid arthritis, ulcerative colitis, and psoriasis. Acquired hemophilia usually diagnosed when patients present prolonged bleeding or extensive bruising on the trunk, legs, and arms, which looks very different from usual injury-related bruising. A simple blood test can determine if there is a lack of clotting factor 8. If left untreated, it can be very serious and life-threatening. Acquired hemophilia can be treated with immunosuppressive drugs and injection of clotting factor. Difference between congenital and acquired hemophilia. Characteristic: age of presentation for congenital hemophilia, infancy or childhood. For acquired hemophilia, old age, biphasic. Sex, only congenital, only in males, and acquired hemophilia, males or females. Family history of hemophilia for congenital usually present, and for acquired absent. Bleeds, for congenital hemarthrosis common, and for acquired hemarthrosis rare. Characteristic for inhibitors: alloantibody for congenital and autoantibody for acquired. This picture shows World Hemophilia Day in the 17th April. And now we have this video as a conclusion of the subject.
So, what is hemophilia? Hemophilia is a bleeding disorder, a problem with a person's blood that makes them bleed longer than a person without hemophilia. No one can catch hemophilia. It's an inherited condition you have from birth, for your whole life. It's just part of who you are, like the color of your hair or the shape of your nose. Here's how it works. Your blood travels through your body in tubes called arteries, veins, and capillaries. Normally, when there's a tear or hole in one of these, bleeding starts, and different parts of the blood go to work to plug the hole. Blood cells called platelets gather at the opening, and other blood parts called clotting factors help hold the platelets together to form a clot that stops the bleeding. When a person has hemophilia, he doesn't have enough of one of those clotting factors he needs to form a clot, and he keeps bleeding longer than he should. Each person with hemophilia is missing one of two kinds of factors. If you're missing factor 8, you have hemophilia A. If you're missing factor 9, you have hemophilia B. Either one can be mild, moderate, or severe. Without regular treatment, having hemophilia means you'll bleed longer than you should if you get cut. But you don't have to have a cut to have a bleed. Sometimes, especially when you're active, the tiny capillaries inside a person's body will bleed, causing a bruise or pain in the joints. Not dealing with those kinds of bleeds can cause a lot of problems later, including arthritis at a young age. But the good news is, there are good treatments available that can help you manage hemophilia effectively. Treatments that replace the missing factor help your blood clot more like a person who doesn't have hemophilia. These treatments, when used properly, help you keep your bleeding under control so you can live a long, healthy life and follow your dreams without hemophilia ever holding you back. To learn more about hemophilia, visit worldhemophiliaday.org.
And thank you.